Welcome back. In today's video, we are going to discuss about the treatment of acute otitis media. Medical treatment. First, you have to start with the antibiotics. Traditionally, this antibiotic therapy is continued till the tympanic membrane and the hearing will come to the normal. Different antibiotic regimes have been suggested, starting with a single IM dose of ceftriaxone. Intramuscular dose of the ceftriaxone have to be given, or a 5-day course or 10 to 14 days course of oral antibiotics can be given. You can see in the picture, ceftriaxone injection or oral doses can be given a 5-day or a 10 to 14 days course. The first line of antibiotic. So as the person comes with acute otitis media with the problem in the tympanic membrane, which we discussed in the previous video in detail, the stages and everything, you have to remember that. And then there is kind of hearing loss, conductive hearing loss is there. So if they come with that, you have to start, the first line will be amoxicillin, and the children who are allergic to the penicillin have to be given cefaclor, cotrimoxazole or erythromycin. Cefaclor or erythromycin have to be given. See, cefaclor and erythromycin. Medical treatment, decongestant. So if the person complains that he is unable to sleep at night, having a stuffy nose, cannot breathe, so you have to give them some decongestants for the instant relief. Oxymetazoline or xylometazoline. Oxymetazoline, also popularly known as Nisivion, or xylometazoline known as Otrivine Oxy. These are the decongestants which will give a relief from the stuffy nose. Nasal drops, like we saw previously. This thing again, another one, a nasal drop or oral pseudoepiphrin 30 mg and phenylephrine hydrochloride with or without the antihistaminic are said to relieve the eustachian tube's edema, and it will promote the ventilation of the middle ear. So guys, what's happening? This pseudoepiphrin and the phenylephrine hydrochloride, what do? They are antihistaminic in nature. Along with this, with or without the antihistaminic, they will relieve the eustachian tube's edema and they will promote the ventilation to the middle ear. The analgesics and antipyretics. What are the analgesics and antipyretics you giving? The paracetamol, which will take care of the pain and the fever. So there is inflammation, for the fever to come down and the pain, we give some antipyretics for the fever and analgesics for the pain. That is paracetamol, which can take care of both pain and fever. Ear drop and the oral toilet. Ear discharge must be clean. Why are you giving the oral toilets here? It is to clean the discharges. Water is prevented from entering the ear. So one of the oral toilet is Otiflox. Okay. Then the dry local heat, which will relieve the pain. Surgical treatment, tympanocentesis. It is a procedure in which it is a needle aspiration of a fluid from the middle ear. So you can see in the picture here, the fluid from the middle ear is being aspirated. The culture and sensitivity of the ear fluid is done to know the organism, to find out the causative organism for the acute otitis media, and also we are selecting the antibiotic which is sensitive to that microorganism. Premature newborns, immunocompromised patients, failure of previous antibiotic therapy, intracranial complication. So tympanocentesis, it is indicated in the following, that is in the premature newborns, immunocompromised patients, and whenever there is a failure of the antibiotic therapy. When there is failure of antibiotic therapy, we need to find out the causative organism, so we do the tympanocentesis, find out the causative organism and the antibody. The antibiotics have to be figured out. Then intracranial complications. In case of intracranial complications, you have to do the tympanocentesis. So you know the fluid is aspirated from the middle ear. Myringotomy, In meningotomy, what's happening? An incision is put in the tympanic membrane to evacuate the middle ear fluid. Okay, so guys, you see in the incision is made into the tympanic membrane. The placement of the tube with the forceps, with the help of the forceps, you're placing the tube is being placed, and now the fluid has been removed. Okay, this is a blocked eustachian tube. So from here the fluid which is built up in the middle ear, you can see the fluid which is built up. So what they are doing here, they are putting an incision into the tympanic membrane. They are evacuating the middle ear fluid. It is preceded by tympanocentesis. The indications of this are bulging eardrum. This is done if there is an obstruction. So you see here the eustachian tube is blocked, so the fluid cannot come out. So the tympanic membrane, obviously because of the accumulation of the fluid, it is going to be bulged out. In case of a bulging eardrum, acute excruciating pain, unresponsive to the antibiotics, and when there is facial palsy and intracranial complications. So guys, in meningotomy, incision is made into the tympanic membrane. There is a drainage of the middle ear fluid. When do we do it? In the bulging tympanic membrane, excruciating pain, facial palsy and intracranial complications. Mastoidectomy, removal of the mastoid bone. Diagnosis of osteitis. So osteitis is nothing but the inflammation of a bone. On the CT scan will warrant that mastoidectomy to remove the necrotic and the infected bone. So there is inflammation of the mastoid bone. So we have to remove that necrotic, that is dead, and the infected bone have to be removed. So the incision and drainage of the subperiosteal post-auricular abscess, and also there is an incision and drainage of the subperiosteal post-auricular, behind the ear, subperiosteal post-auricular abscess. So you can see here the mastoid bone, mastoidectomy. So before the surgery, the cholesteatoma formation. So guys, the cholesteatoma is nothing but a mass which is non-cancerous, which is grown in the mastoid hair cells. So this cholesteatoma along with the bone has been removed, because this cholesteatoma have already causing the bone erosion. This cholesteatoma, what does it do? It will erode the bone. Because of this, we have to remove the cholesteatoma along with the bone. The incision and drainage of the subperiosteal post-auricular abscess, and we have to remove the necrotic and infected bone along with the cholesteatoma. Tympanoplasty. In cases of permanent tympanic perforation and in ossicular necrosis, the tympanoplasty have to be done. In tympanoplasty, what do we do? See guys, this is a normal eardrum. Now this is a perforated eardrum. Because of the perforation, what we are doing? We are taking a tissue and we are placing it there. The grafting has been done here. In cases of permanent tympanic perforation and ossicular necrosis. Ossicular necrosis is nothing but the bone death. If the bone is dead, and then there is permanent perforation, there is cholesteatoma formation, then it is causing the bone erosion. In such cases, tympanoplasty has to be done. Thank you.